Chairman, I asked to be recognized to speak in favor of Mr. Doggett's amendment. And I can't imagine my going home to my constituents is any different than any of the rest of you on this committee. Healthcare always comes up in town hall meetings and meetings with the business community, with anybody that I meet with at home, the Ag Committee. And one of the major concerns that people have is the issue of pre-existing conditions. And it affects everybody. Parents who have young children who are born with a medical condition, not only do they have to struggle to pay for the health care that their young child needs, but as any parent would, for the rest of the time on the face of this earth, they're going to worry about that young child. They're going to worry that he or she has access to the health care coverage that they're going to need because of this pre-existing condition. Senior citizens worry about that. You know, let's face it, if you're as old as anybody on this committee, you are a pre-existing condition. And people know that. I hear from people all the time at home about this issue of them being charged extra or being charged out of health care coverage because they're a pre-existing condition. And you've heard the list repeated a number of times, things that, you know, unless you're confronted with it, you don't even know that it's a pre-existing condition. It is a problem. It's caused people to go without health care. It's caused people to become more acutely ill because of not getting the coverage they need. People know this. This is one of the main things that everybody in every one of our districts has in the back of their mind when it comes to health care. So if in fact it is duplicative language, why in the world don't we just adopt it? If it's duplicative, by definition, adopting it's not going to hurt anything. And it's certainly going to help folks in our districts who have to deal with the constant torment of trying to figure out how they're going to handle their own health care needs or the health care of their children. You know, I remember after we passed the Affordable Care Act, my district still extended up to the Oregon border along the coast in California, and I got an email from a woman who, she and her husband had a business up on the North Coast, and she informed me that she was opposed to the Affordable Care Act for all the reasons that all y'all have been saying it's bad. And she said, but then her husband got sick, seriously ill. And they were confronted with losing everything that they had been able to put together for their entire time together. Their home, their business, their savings account for their children's education. And she said if it weren't for the fact that we passed the Affordable Care Act, they'd be out of house, they'd be out of business, and they would have depleted their entire savings, including their educational savings for their kids. And then she went on to say that the Affordable Care Act helped him get the health care that he needed, but now he had a pre-existing condition. And she knew that if we let our guard down, they'd be right back in the same financial fix they were in before we passed the Affordable Care Act. This is a real issue. This is an important issue to the lives and the health of every person that every one of us represents. So I would encourage us to put the partisanship aside for a minute and adopt this amendment that Mr. Doggett has put forward for the sake of the people that we represent. And as the author said, it's only duplicative, so it's not going to cause any problems. So I urge us to adopt this amendment.
Gentleman yields back. Ms. Delbene, you're recognized.